I had COVID-19 and I was pretty sick. Bad headache and extreme lower back pain, and I was scared. So I contacted MedStar Health, and immediately I was admitted, and they went through all my symptoms and they determined that since my case wasn't as severe as others, they sent me home with the at-home monitoring system. It was very easy, very convenient. It took me a few seconds to download the app. The pulse ox monitor was very simple. You just put it on the tip of your finger and push one button and it was done. The results are immediately transmitted to their system where their nurse practitioners can take a look and determine if you need further care. They monitored my condition daily. They were still looking after me, but remotely.
Andrew's a terrific example of what remote patient monitoring can do because it allows him to stay at home but stay safely within our care. It was a really important capacity that MedStar has built for care of our community, and it's been really valuable to them.
So several years ago, I became familiar with MedStar Health because I had a kidney transplant, and the care that I've received through MedStar Health has been nothing short of amazing. When they say they're superheroes, they're not kidding. I feel that way.
Andrew's particular circumstance of immunocompromise after an organ transplantation is one of the classic examples of those patients who should be carefully managed for risk of communicable disease. That monitoring was really valuable. That's different than the chronic condition monitoring, which we also do. So monitoring for hypertension, congestive heart failure, diabetes, these are all capacities that MedStar Health is building and exploring. It's a flexible program. If the community numbers suggest that it's required, we will turn it back on.
For roughly 3 weeks, they monitored my condition, and it worked really well for me. COVID's no joke, and I'm very grateful. It's amazing. You receive the care that you need, even if you're at home.